So acalabrutinib is a second-generation BTK inhibitor. It is much more selective than ibrutinib is, so it's predicted to have less toxicity due to not inhibiting a lot of the other kinases that ibrutinib does, things like EGFR, ITK, and as well, the lack of ITK inhibition may make acalabrutinib a better combination partner for antibodies than ibrutinib is. So we undertook a study in patients with both treatment-naive and relapsed and refractory CLL. 19 treatment-naive patients, 26 relapsed and refractory, treated with a combination of acalabrutinib with obinutuzumab. We now have 3-year follow-up data on these patients, and people have done exceptionally well with this regimen. At this time, 78% of patients remain actually on treatment and doing well. We've only had 1 patient progress with CLL that was in the relapse setting. We have had 3 patients total progress with Richter's transformation. Unfortunately, those were patients who were kind of at higher risk for Richter's transformation at baseline. Very few patients have come off for toxicity as well. So we're continuing to see exceptional responses, very good durability of remissions, and obviously good survival with this regimen. It's currently under investigation as part of a phase 3 study, which hopefully we'll have results of soon, and that was acalabrutinib plus obinutuzumab versus acalabrutinib alone versus chlorambucil plus obinutuzumab.